every year, the world unites to create awareness on fundamental cancer issues. The theme for this year, 2024 World Cancer Day, is Together We Challenge Those in Power. And this is the basis of our interview this morning. With me in the studio, I have Dr. Adegulu Daniel. He is the Senior Registrar, Department of Obstetrics and Gynecology, Federal Medical Center, FMC, Asaba. Good morning, sir, and welcome to Morning Right.
Good morning.
I also have Dr. Wayimi Francis. She is the State Reproductive Health Coordinator, Ministry of Health. Good morning, ma'am. Welcome.
Good morning.
Also with me this morning is Dr. Onyeka Anthony, Specialist, General Surgery and Oncology. Good morning, sir. You're welcome.
Good morning. Thank
to
you.
Morning Right.
Thank you very much.
So the month of February, the world unites to create awareness on fundamental cancer issues. So I'm going to be asking Dr. Adegulu Daniel, what is cancer?
Yeah, thank you very much. Cancer has to do with the growth of cells and multiplication of cells. Now, the body naturally grows by our body cells increasing in number and size. And it has a control. It gets to a point, the cells, they die, so that new ones come up. But then in cancer, what happens is that the cell continues to grow in size, continue to grow in numbers, and then doesn't stop. So the program stopping, I'm trying to break it down, doesn't occur. So the cell continues to grow, and it grows, and it begins to grow beyond its confines. So that is cancer. So the cells grow beyond the tissue is supposed to be in, the confines is supposed to be in, and it has a tendency to spread to other tissues. So that is cancer. Cell growth without control and with the tendency to spread to other parts.
Okay, Dr. Onyeka, what are the causes of cancer? Because people would say that, nowadays we have more cases of cancer, and that was not how it used to be back then. So what exactly causes cancer?
Okay, thank you very much. Actually, the actual cause of cancer is not known. But what we know is that there are what we call the risk factors or the predisposing factors.
Okay.
These predisposing factors have to do with, is dependent on the type of cancer. Okay? But generally, we can group them into preventable ones and the ones that you cannot prevent. But the actual etiology or cause is not known. Then the preventable ones, which we can prevent, include, number one is cigarette smoking. These has to do with our lifestyles. Another one is too much intake of alcohol. Also, another one is poor nutrition, because it has been discovered that a lot of cancers are associated with what we eat. Some things we eat contain some chemicals and preservatives that can trigger a change in the cells of the body, causing an uncontrollable increase in size that can now lead to the cells to grow bigger than what it takes.
Okay.
Then another one again is our lifestyle also, like some cancers of the cervix, which has to do with multiple sexual partners. Because there is an infection we call human papilloma virus, which can be transmitted through sex. So when you get it by having multiple sexual partners, it can lead to what we call cancer in years to come. Then the ones we cannot prevent, which is non-preventable factors that can predispose you to cancer, it doesn't mean that you must have it, include age. Researchers have shown that increase in age causes an increase in cells growing without control of the normal body metabolic control. However, nowadays we are seeing cancers in younger people, unlike before. Another one that can predispose you to cancer is genetic factor, family history. For example, if a girl, a lady, your mother suffered from breast cancer, you might end up having it. Maybe, I think that it was a genetic factor. Your mother has an abnormal gene that can predispose to cancer, or an abnormal gene that because they are what we call tumor suppressor genes that will prevent cells from proliferating abnormally. If you have issue with it, and the thing was transferred to you during your childbirth, you have the risk of having cancer. It doesn't mean that you will come down to it.
Okay. Is cancer new, like COVID-19, Lassa fever, or has cancer always been there, but the awareness have not been created?
Okay. What we can say now, we have, I can say that cancer has been there, but not as it is now.
Okay.
So the incidence is increasing on the daily basis. Like in our clinic, almost every week we saw about at least 5 new cases a day, and we have 2 clinics, so about 10 cases in a week. So I can say that one, it has been there, but the incidence wasn't the way it is now. Also now we have a lot of instruments, equipment that can help us to detect cancer. Also now the knowledge, some people now they have started having the knowledge. That is the essence of this program too, to create the awareness. Some people have started having the knowledge. So when they notice some abnormalities in their body, some present, while some present very, very late.
Okay. All right. Dr. Wayemi Francis, is cancer a death sentence?
No, cancer is not a death sentence. Cancer is actually treatable. Some of the cancers are actually treatable. In fact, 30 to 50% of cancers can be prevented with the right kind of information and the right kind of lifestyle modifications. So one of the reasons why we are here today is to dispel all those myths and misconceptions around cancer. People should not have they should not have the perspective that once they are diagnosed with cancer, they can die. If with the right, if they present early, they see a doctor or a specialist, an oncologist, and treatment starts on time. In fact, they can be cured 100% in some cases. A lot of misconceptions are there. Some people think cancers can be contagious, which is not true. Cancers are not contagious in any way. They also think cancers are only for the elderly people, and that's not true as well, because cancers can be, as long as you're alive, if you're a baby, if you're a youth, a teenager, cancers can spread. Another misconception is people think that cancers can be cured by over-the-counter medication, or by herbal medication, or by going to church and prayers and all that. A lot of work, like my colleague has said, has been done on cancers, and there are innovative treatment procedures that are available. So if an individual is diagnosed with cancer, he can actually get treatment and he can live his life to the fullest.
Okay, I think one of the reasons why people have that misconception that cancer is a death sentence is because they've seen cases of people come down with cancer and they die. No matter the treatments that they go through, the medications they use, the death rate seems to be higher than the survival rate. So,
well, okay. That's true, and one of the primary reasons why is because a lot of the people that present in the hospitals come late. When they have these symptoms that they really don't know much about. A lot of them go to Google, they go to church, and they try on their own, or from friends and newspaper clippings or whatever wherever they get the information to try to treat it on their own, which is very wrong. Once you have a symptom, you're not familiar with something out of the ordinary, anything. In fact, it can be a little lump, it can be a change in skin color, something that is out of the ordinary. We always advise an individual to go to the hospital, even if at the end of the day it may be nothing. We advise that they go to the hospital, because like my colleague said, cancer, the incidence is on the rise. We are using a lot of preservatives, we are eating a lot of foreign food that need to be preserved longer, and so we've left the natural things and we're eating preservatives, so therefore the incidence is rising. So death is not imminent if you come early. A lot of them come in stage 3, stage 4, and at that point the cancer has metastasized, meaning that it has left its primary location and it is in somewhere else, because that's what cancer does. Once it outgrows the primary location, it moves everywhere because it spreads through the lymphatic system. And the lymphatic system takes the cancer cells all over the body. And so it's at that point where there's almost nothing that the medical doctor can do that the patients usually present.
Okay, it is important for us to note that this interview is sponsored by the Niger Delta Development Commission, NDDC. So back to you, Dr. Adewolu Daniel. Please tell us examples, give us examples of common cancers. And then Dr. Wayne Francis mentioned that some persons come late. So when you give us the examples of common cancers, also let us know the symptoms one would see for the person to know that, oh, this is abnormal and I need to go to the hospital to check if I have cancer.
Okay, thank you. Now, cancer can affect any part of the human body. Any part, from the skin, the eyes, the different organs, the different organ system, the lungs, the kidneys, the cervix, anywhere can be affected.
I've also heard of cancer of the blood.
Yes, leukemia. So bones, anywhere can be affected. Now, there are common cancers worldwide, and they include the colorectal cancer, has to do with the large intestine, breast cancer, cancer of the lungs, cancer of the liver, and they also have cervical cancer when it comes to the female reproductive organ, cervical cancer, endometrial cancer, ovarian cancers, and so on and so forth. Now, based on how they present, that would be what organ is affected. And for example, let's focus on the women, for example. Cervical cancer usually takes a long time to even show a sign. It would have gotten to a late stage before it presents. Hence, we'll talk later about screening and prevention. Now, vaginal bleeding, or like bleeding after sex, or for a woman who has stopped menstruating, that is menopause, suddenly begins to bleed again, or a foul-smelling vaginal discharge, should raise an alarm. It should not just be treatment, I have to go and treat something over the counter. Now, the same thing happens, let's say ovarian, that's the ovaries, the two eggs you have in the woman. It can come with abdominal distension, easy satiety, weight loss, and all of that. You go to, like for example, you go to other parts of the body, the lung cancer, difficulty in breathing, coughing out blood, and all of that. Weight loss, so it can come in different ways. Hence the need to, take cancer holistically. It can affect anybody. So the presentation can be early, it can be late. Now when such people come early, they are usually, just like my colleague said, you can manage them and they will have normal life or near to normal life. So if there's any change, which is why we are here, let's not wait till we've done everything before going to the hospital. At the slightest symptom of, I think I feel unwell in this part of my body, let's check. It could just be cancer.
Okay.
Thank you.
All right, Dr. Onyeka Anthony, speak to us about the stages of cancer and what to do once you notice these symptoms that Dr. Daniel has spoken to us about. What do we do? What was the next step of action? And then talk to us about the stages of cancer as well.
Okay, when you talk about the stage, there are lots of staging criteria we are using depending on the type of cancer. Yes. I will start, let me use common cancer of women, breast cancer. So there's what we call TNM stage. TNM means the tumor size, the size of it. N means the nodes, that's what we call nodes. At times if you feel your armpit, at times you feel as if you are having pains or something swollen there. So that one is called the lymph nodes. Then M has to do with metastasis. Metastasis means it has gone beyond where the cancer is. So in terms of T, once you feel any lump there, I'll use simple ones so that people can understand. Once you feel any lump there and you estimate the size, once it's less than 2 cm, we call it T1. T1 stage. Those ones are early stages. As we said, when you meet the cancer early, I'll use this opportunity to say there is a woman we are managing now. Is 18 years now counting.
18 years?
Yes. No, it's cancer free. She presented very I think the tumor was about 3 cm. We did normal treatment, and she took her drugs, chemotherapy, did the radiotherapy, and I'm 18 years counting. Sure, we see her now in 3 months. Just come, we'll check you go. So it's never a death sentence at all. It all has to do with the stage.
Right.
So as I was saying now, so when it comes to T2, that cancer has the measurement is more than 2 cm, but less than 5 cm.
Okay.
So it goes there until you get to T4. T4 has to do with it can be any size, but it has involved maybe the skin of the breast or even your chest. So, but when you now talk of M there, M has to do with that cancer. That breast cancer is no longer, because as my Dr. Debu said, we call it cancer. Apart from the tissues growing uncontrollably, they have the ability to spread beyond where you see it. So you can even see some people with breast cancer. Their first presentation will be fast breathing. They won't be breathing very well again, because it has the ability to spread to the chest. There are some people with breast cancer, their first presentation we have in the world, and their first presentation was inability to walk very well, because it can spread to the back, affecting the spinal cord. But at times, I have a weakness of your limbs. So when it gets to those stages, it has gone beyond that breast. We call it metastasis. That is the M stage.
Okay. So once you notice the symptoms, what next? What do we do?
Sorry, I will phrase that question, or I'll answer in it. I don't want us to wait until we get those symptoms.
Okay.
Because that is the essence of the program. Although my colleagues, they will talk on how to prevent and screen. But as my doctors, Dr. Debu said, each of these cancers, they have the way they present. Like the common, I'll just give a summary of 2 or 3 cancers, how they present. Once you notice some of these things, like breast cancer, you feel a lump in your breast, you are feeling sure. When you start feeling, it mustn't even be lump, so when you start feeling any pain, apart from the one that engorgement that comes during menstruation and ovulation, once you feel any pain or anything, or you even feel that there is something that is siege, go to a hospital, go to a good hospital. Once you start, your nipples the skin over your breast start changing appearance, and even be like the back of an orange, we call purulence. Or you see redness, or you even feel you have nipple discharge, go to a hospital, go to a good hospital.
Okay.
That one is for breast cancer. If it is for cancer of the large intestine, as I said, once you notice that you are not going to toilet very well, you are passing blood in your stool, you are stooling blood. If you go to toilet, once you feel the urge, but when you get there, nothing will come out. Go and see a doctor. Another common one that is even common in younger people are cancer of the stomach. It's very common because, thank God I even remembered it. A lot of us are treating ulcers. You are having pain here. Some of us have treated the ulcer for about 5-10 years, because they go to the chemist or wherever, they give them drugs. They will continue drinking ulcer drug, not knowing that it's a cancer of the stomach. So there's even a man I saw, he has taken all these antacid, gestid for about 5 years. Unfortunately, the test we did, the scan we did, showed that he has the cancer of the stomach. That is even the one one of the endangering cancer nowadays. Okay. Once you start feeling pain on your upper tongue, please go and see a doctor. Don't wait until you start having the complications.
Okay. Dr. Wayne Francis, just like we have COVID-19 and we have vaccines for COVID-19, do we have vaccination for cancers that people should go take to avoid getting cancer?
We don't have specific specific vaccinations that can prevent cancers, except some of the risk factors. Like in the case of cervical cancer, we have infections of the human papillomavirus, and that particular virus has a vaccine that can actually prevent the HPV infection. That's we advocate for young girls between the age of 9 and 14 to take. But what we put emphasis on is prevention, which is better than cure, because a lot of research is still going on worldwide concerning cancers, and we are hopeful that someday in the future there will be a vaccine that we can categorically say will cure cancers. But for now, there isn't. We have things that can prevent the risk factors from coming, which is the HPV vaccine. And fortunately for Delta State, we are rolling out the vaccine sometime in April, May, and we are hopeful because it's one of the commonest cancers actually now in Nigeria, and it's killing a lot of our women. So we hope that once we vaccinate our young girls between those ages, we are going to be able to reduce the risk to an extent. And even though there are multiple factors that can cause cancer, but we try to emphasize that prevention is better than cure. So everybody should be screened. You should ensure that you are being screened regularly for all these risk factors.
How often should a woman or a man go for screening?
It's dependent on the cancers, but usually what you will do is go to the hospital and tell the doctor, once you get to, let's say for a woman from 35 years and for a man from 40 years. So there are specific cancer markers that you can check for in specialized hospitals. But for the basic tests that you can do a self-breast examination at home for women. You can do a mammogram every 2 years if you're a woman above the age of 35. You can do a prostate screening if you're a man above 40. And then you can also do a general checkup. Just go to the hospital at least twice a year and check your kidneys, check your liver function, check your do a full blood count, check your blood levels, and just ensure that you are healthy. Because it's at this point that you are able to pick some of the early signs or some of the early symptoms that come with cancer. So we are here basically to advocate regular screening and then early presentation when you do have symptoms of this that you know nothing about. You just wake up one day, you see that the left side of your breast is darker than the right side, or you wake up and you're stooling blood, or you wake up and you're coughing blood. Anything out of the ordinary that is not part of your everyday, you should definitely have it checked out.
Okay, thank you. We've been speaking to Dr. Adebulu Daniel, the Senior Registrar, Department of Obstetrics and Gynecology, Federal Medical Center, FMC, Asaba. Also, we've been speaking to Dr. Wayme Francis, the State Reproductive Health Coordinator, Ministry of Health, and Dr. Onyeka Anthony, Specialist, General Surgery and Oncology. We'll go on a short break, and when we come back, we'll be speaking to the State Health Promotion Officer this morning. Please stay tuned. Welcome back to Friday's edition of Morning Ride. On our interview segment today, we're talking about cancer awareness, prevention, and treatment. And joining us this morning is Mr. Emmanuel Odejero. He is the State Health Promotion Officer. Good morning, sir.
Good morning.
Thank you so much for joining us.
Good morning, Deltans.
So back to the topic, Dr. Wayme Francis. What is the government doing to help create cancer awareness, to prevent and to treat cancer patients we have in Delta State?
Well, thank you very much. The government, through the Ministry of Health, is doing a lot with regards to raising awareness on what cancer is, the causes of cancer, and how early presentation is apt when it comes to treatment of cancer. In the Ministry of Health, we have the NCD unit, which is a non-communicable disease unit. We just recently got a new budget line to help develop strategies from the policies from the Federal Ministry of Health to help our public health facilities get equipment, get our staff trained, improve the capacity of our healthcare workers to help examine patients, help diagnose cancers, and refer to specialists as quickly as possible. We're also doing a lot with regards to provision of essential medication in our primary healthcare centers, to address some of these symptoms and signs when patients present before they are referred. Again, we also are doing a lot with regards to awareness creation. My colleague here is going to speak about that. We also have a lot of partners that are coming in to help us to support the good work that we are doing in the ministry. We have organizations like NDDC, one of the organizations that are sponsoring this interview today. We have WHO. We have a lot of non-governmental organizations, a lot of faith-based organizations, community-based organizations that have come and put resources, human resources and financial resources together to help raise awareness. So a lot of screenings are taking place across the states, in different local governments, in different facilities, so to help diagnose various cancers early enough and then refer them to the appropriate area.
Okay, I would like to focus more on what the government is doing. So I'll be speaking to Mr. Emmanuel Odejero. You are the State Health Promotion Officer, and the theme for this year's World Cancer Day is Together We Challenge Those in Power. What is the state government doing to prioritize and invest in cancer prevention and care?
Thank you very much. Like my colleague has said, the state government have actually taken it as a pertinent body. Formally, we do not have what we call budget line for health promotion activities. But as we speak, it's in the budget. It was there last year, and it's also there this year. Now, the essence of that budget is not just creating budget line, but for specific purposes. The health promotion officers are officers that go to markets, churches, religious houses, the CSO, they also collaborate with CBOs, like that. Now, the essence of the budget also is to acquire equipment like megaphone, where they will use to go to the market. They even go as far as even door to door, sensitizing people to see that they actually, check themselves. Because let's say, for example, prevention is better than cure. The market women, they believe on, hey, let me sell my goods and make money to feed my family. And so it is the duty of the health promotion officer to go to the market and create more awareness on this activity. Just like what we did last week. It was as a result of government policies. We said, no, we will not sit down. It's not just to be in our office. Let's go to the streets, let's go to the market, let's go to religious houses. They are with their megaphones and so on and so forth. So these are some of the things that the government is actually doing in order to curb these ugly menace. Okay,
the budget you talked about, does the budget also help subsidize the treatment of cancer to patients who come to the hospital and it's discovered that they have cancer? Does this budget help address the issue?
No. It is specifically, when you talk about health promotion activities, it is for probably logistics, to get those equipment that these health promotion officers will use in creating awareness. And so not for diagnosis. Because when you are talking about that, the money that you use for that is not a petty money. When we say budget line, not that the government have actually created one huge amount of money.
Okay.
you expect somebody that is in the central aspect. She talked about capacity building.
Yes.
Just like if I want to invite the health promotion officers, they need to come all the way from Warri, Butu. That fund is meant for logistic transportation to aid their movement in order for capacity building, to get more latest information on the program.
Okay. Dr. Adebulu Daniel,
yes.
you work with the Federal Medical Center, FMC, Asaba. In Delta State, would you say we have the needed equipment to help treat cancer in Delta State?
Well, when we talk about treat cancer, we're making a very big statement, as if all cancers are just treatable.
Okay. Not all are treatable.
So, permit me to take it through a line, just like my friend changed the question. Now, prevention is always better than cure.
Okay.
Now, do we have what it takes in Delta State to prevent cancers? Yes, our chief has just said something. The awareness is going out. Now, because when we talk about treatment, it's so expensive. Now, treatment, first of all, prevention is always cheaper and better. So we have what it takes to do that. Announcement programs, this one, and I know it's going to go far. It's going to go really far. Now, when cancers come early, yes, we have what it takes to treat them. For example, for radiation, yes, we can have our radiation, chemotherapy, drugs. If it's a breast cancer, for mastectomy, it can be done. If it means doing some surgeries for the woman who has cervical cancer, it's doable, it's possible. Now, but when you now talk about the advanced stages, not just Delta stage, there are very few centers in Nigeria where you can do some treatment for patients who come in late. So you need to send them sometime to Maiduguri, some to, I think, Edo State, to some very few, and their machines keep breaking down because one machine may take care of 1,000, 2,000 people. So the essence is prevention, early detection.
Okay.
And I think we have what it takes to do that in Delta State.
Okay, Mr. Emmanuel Odejeru, you talked about creating awareness. You said you did a sensitization recently, going to the market to meet the market women to talk to them about cancer. How often do you do this sensitization? How often do you create this awareness? Do you go to schools as well to talk to young girls? Do you how often do you do this sensitization to sensitize the people and let them know that cancer is something they should actually place
Thank you very much.
priority on?
It is part of our routine activities. We have what we call work plan. Every month, as we speak now, by this month 23rd, the activities that the health promotion officer have done in their various LGAs, they will come to Asaba. We will now review it.
Okay.
Cancer is not an obsession. That is what is on board now. That is what is giving us ache for the now. And we integrate even as other programs are going on. So at weekly basis, monthly basis, daily basis, we create awareness in schools, in churches, in streets, in religious houses, with evidence of photographs. So these are the things that we do.
Okay. As we wrap up this interview, Dr. Adebolu Daniel, your last words to Deltans.
Well, cancer is deadly, and nearly all cancers can be prevented or detected early. So we should make time to take care of ourselves, come to hospital early, and then get treated, get detected early, and then let treatment be done. And that's for everyone. And general health awareness, just like sometimes people just want to listen to music. Take time to listen to things that affect your own health, and then it will better your life. Thank you.
I just want to ask, people still have this myth, like Dr. Wayne Francis said, that cancer is for the old people alone. So I want you to just speak to them and let them know that it's not just for the old people as well. Well, I've heard of cases of very young persons coming down with cancer.
Cancer can affect anyone, aged or the young one. It's there and it can affect everybody. Hence the awareness to know that we've seen children with breast cancer. We've seen young people with cervical cancer. We've seen people with stomach cancer, just like my colleague said. And they are basically young people in early 20s, 30s, ovarian cancer and all of that. It can affect anybody. So that myth of being old for the aged only is off. Secondly, you talk about it's a white man disease. No, it's not a disease for the white man, nor the disease for the affluent. It can affect everybody. And just like we talked about the risk, there's a change in our lifestyle. We go smoking all the time, we go drinking all the time, and then the way to say, oh, you look good is because you've added some weight. Obesity, which is a risk factor for...
Obesity is a risk factor?
Yes, for cancer. So my take home, what I want people to take home is live a healthy life. Stop smoking, drink less, live healthy. Okay. Have a good weight.
Thank you so much. Dr. Wayne Francis, you're a woman, and I don't know, but I feel women are more at risk of having cancer than men. Is that true?
Well, not necessarily. Women do have some cancers that affect them, but for my opinion, the risk is equal for both men, women, and children. Again, I said we mentioned how multifactorial it is. There are so many factors that can come together, and once those factors are in the right place at the right time, that person will come down with cancer, which is why we're advocating that regular checkups, regular screening, so that whatever is there can be caught early if it is there. If you have the genetic predisposition, if your lifestyle is not something to be proud of, if you've done a lot, all these things can lead to cancer. So early screening, regular screening, detect fast, detect early, present early and get treated and live a healthy, long life.
Okay, are those your last words?
Again, we are from the Ministry of Health's perspective, and for all of us, prevention is always better than cure. And so we will always continue from our end to raise awareness, to let people know that cancer is not a death sentence. It is deadly, but it doesn't mean that if you have cancer, you can die. And it can be detected early. So like a popular saying, garbage in, garbage out, every Deltan should learn to take care of themselves. This is not just because of cancer, but in general, exercise, stop smoking, eat well, fruits, vegetables, eat a healthy, balanced meal. This will take care of your whole self, and you can live long and have a lot of diseases prevented by this just simple action.
Thank you so much. Mr. Emmanuel Odejero, your last words, please.
Exercise, she mentioned. Exercise is very, very important. It's a key to the prevention of cancer. Not because we are saying exercise, people will just jump into exercising. We have different stages of exercise. With time permit, with time, we'll talk about that later. We have what we call the mind exercise, the moderate exercise, and the severe exercise. Okay. But what we're just saying is that for this not to occur, you can only take a walk for like 10, you can start for just 10 minutes, 20 minutes, 30 minutes. You can just, mind exercise, not the one that will aggravate another thing in the human body. Now, I still want to say that in churches, in those days, you find out that religious body, they inculcate health programs in their activity, not just preaching.
Yes.
So we still want to bring it up again, that our religious leaders should always, because they say health is what? Is wealth. They should find time to fixate health programs in their church activities, in their mosque activities. The market women, the schools in the market shouldn't wait for the health promotion officer to come to the market to sensitize them concerning particular issues, but rather on their own, the ESCO should also organize and talk to themselves concerning health. Likewise, in schools, we are ready at any time. The Ministry of Health, we are open to anybody that wants to call us for activities on preventive aspect on the diseases that are ravaging deltas. These are preaching.
All right, thank you so much, sir. On a lighter note, Dr. Adebulu Daniel, I'm sure you listened to the conversation I had with Ogaga, my colleague on set, and Ogaga was talking about prostate cancer, and he said something that he saw a video of a doctor saying men should be sexually active for at least 21 times in a month. Is that true? Does that really help prevent prostate cancer?
No, that's not the statement.
Okay, what's the statement?
Actually, a study done.
Okay.
And they compared amount of times a man ejaculates to developing prostate cancer. Now they were aiming that the more sex or the more ejaculation a man has, be predisposed to cancer of the prostate. Okay. But at the end, it was the reverse. So meaning the more ejaculates, the lesser the risk of developing. Now, not sex. The ejaculation was based on both sex, masturbation, or night releases.
Okay.
You understand? The tilt to people now is, let me have sex as much as possible. And I heard him say, if you're not married, or you can have it with so many people. Now you have the risk of contracting other infections. Yes. And then HPV, which can also lead to cancer of the prostate. So it's not about having sex or multiple sex. It was a study that I think over 20-something thousand people were studied for over like 20 or 30 years, and they discovered that. So it releases. So if you're married and your wife can take it 21 years, why not? It's a study. So another study may come up
I
again.
think it's not realistic.
As long as it doesn't affect their health.
Their health.
Exactly. All right, thank you so much. This morning we were talking about cancer awareness, prevention and treatment, and we've had 4 amazing guests this morning to do justice to that topic. We spoke to Dr. Onyeka Anthony, a specialist, general surgery and oncology, Dr. Adebulu Daniel, senior registrar, Department of Obstetrics and Gynecology, Federal Medical Center, FMC, Asaba. The other lady we had today was Dr. Wayne Francis, the State Reproductive Health Coordinator, Ministry of Health. And lastly, Mr. Emmanuel Udejero, the State Health Promotion Officer. Thank you so much for coming today and for creating awareness on cancer. It has been an enlightening and eye-opening interview. Thank you so much for coming.
Thank you.
Okay, the cancer situation in Africa is really disheartening. There's a global demand for leaders to prioritize and invest in cancer prevention and care, and to do more to achieve a just and cancer-free world. So together we're challenging those in power to go the extra mile for a cancer-free Africa and a cancer-free Nigeria. Thank you so much for joining us for Delta TV Morning Ride this Friday morning. Join us Mondays to Fridays at 7 a.m. for our productions every weekday for Morning Ride. I've been the host for today, Blessing Musiagweda, together with Ogaga Ikama. We say thank you so much. A special thanks to our production crew for today as well. Thank you for the good work done. Well, till next week, have a wonderful time. Have a great weekend as well. Bye for now.